Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Neurologic and psychiatric drugs. For which of the following medical conditions would the nurse anticipate that an anti-anxiety agent would not be indicated? Option A. Seizure disorders. Option B. Alcohol detoxification. Option C. Parkinson's disease. Option D. Panic disorder. Right answer is option C. Parkinson's disease. Benzodiazepines may exacerbate the symptoms of Parkinson's disease. When administering anti-anxiety medications to an elderly client, which of the following actions by the nurse is essential? Option A. Monitor vital signs. Option B. Suggest reduced doses. Option C. Taper dose before stopping. Option D. Implement a fall prevention protocol. Right answer is option D. Implement a fall prevention protocol. Increased sedation, dizziness, and hypotension are side effects that place the elderly at high risk for falls. All clients need to have vital signs monitored periodically when taking these medications. Geriatric clients may require reduced doses, but the risk for falls is still present. Dose tapering is not related to age. When monitoring a client who is taking benzodiazepines, the nurse should be alert for which CNS side effects. Option A. Blurred vision, anorexia, dysarthria. Option B. Seizures, tremors, diaphoresis. Option C. Ataxia, sedation, dizziness. Option D. Libido changes, edema, dystonia. Right answer is option C. Ataxia, sedation, dizziness. These are common side effects. Anorexia is a GI effect. Choice B are the result of acute withdrawal. Libido and edema are not CNS-related side effects. Antidepressants generally exert influence by option A. Increasing the reuptake of norepinephrine. Option B. Altering the action of the cyproprotein, MAO. Option C. Changing the availability of dopamine. Option D. Changing the availability of select neurotransmitters. Right answer is option D. Changing the availability of select neurotransmitters. This choice best describes the effect of antidepressants in general. The nurse performs an initial assessment and nursing history with the client admitted FIR a major depression. The client has a history of narrow-angle glaucoma. The nurse's best action would be to option A. Encourage the client to use his or her own eye drops until the drops can be ordered. Option B. Administer the TCA as orders and expect an ophthalmology consult. Option C. Administer the TCA as ordered and monitor for visual changes. Option D. Inform the physician of the client's history before administering the TCA. Right answer is option D. Inform the physician of the client's history before administering the TCA. Narrow-angle glaucoma is a contraindication for use of TCAs. Therefore, the physician should be informed so that an alternative category can be used. Antipsychotic drugs are indicated. Option A. For treatment of Tourette's syndrome. Option B. For treatment of major depression. Option C. As an adjunct in the management of seizures. Option D. To cure psychotic disorders. Right answer is option A. For treatment of Tourette's syndrome. Haloperidol, Haldol, is used for this syndrome. Major depression is an affective disorder. When psychotic symptoms accompany depression, antipsychotics may be used to manage the symptoms. However, this choice does not address that situation. Antipsychotics are used with caution in the presence of a history of seizures. Generally, the antipsychotics decrease the seizure threshold. Antipsychotics are used to ameliorate, reduce, or manage psychotic symptoms, They do not provide a cure. Sheila, who has been on a low-potency antipsychotic for 2 weeks, has shown minimal response. The most probable explanation is Option A. The client probably has refractory illness. Option B. The client needs a stronger medication. Option C. It is too early to see a full therapeutic response. Option D. The client is definitely not taking the medication. Right answer is Option C. It is too early to see a full therapeutic response. The initial response may be seen 1 to 2 days after initiation of treatment, with full therapeutic response in approximately 6 to 8 weeks. Ansherina, who is receiving a traditional antipsychotic agent, complains that she is gaining weight. The nurse would Option A. Be aware that this is probably delusional thinking because these agents cause weight loss. Option B. Encourage the client to follow a healthy diet and use diet soda to help stabilize her weight. Option C. Discuss a switch to a high-potency agent so the weight gain will not be a problem. Option D. Establish a contract with the client to carefully follow her high-calorie diet. Right answer is Option B. Encourage the client to follow a healthy diet and use diet soda to help stabilize her weight. These agents have a known side effect of weight gain. Managing dietary intake can assist in the management of the potentially distressing effect. Drugs classified as centrally acting skeletal muscle relaxants are most effective in relieving Option A. Spasm due to trauma or inflammation. Option B. Chronic spasm due to old injury. Option C. Pain from arthritis. Option D. Surgical complications. Right answer is Option A. Spasm due to trauma or inflammation. Centrally acting skeletal muscle relaxants are most effective in relieving spasm due to trauma or inflammation. Peripherally acting skeletal muscle relaxants are used. Option A. To treat neuromuscular diseases. Option B. To treat spinal trauma. Option C. To relieve spasms from trauma. Option D. As adjuncts to general anesthesia. Right answer is Option D. As adjuncts to general anesthesia. Peripherally acting skeletal muscle relaxants are used as an adjunct to general anesthesia. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.